Hello everyone. We'll take some minutes to talk something about the first-line treatment of ITP. As you know, nowadays we decide to treat our patient mainly depend on the platelet count. If the platelet count is less than 30 times 10 to the 9th, we start our treatment. And if the patient platelet count is over 30, however, he has bleeding or a very high risk of bleeding, then we also can start our treatment. Recently, there are a trend that we cannot depend only on platelet count, but also bleeding score and health-related quality of life, and also fatigue score. So if we decide which patient should be treated only on platelet count, which is not accurate because the most related factor to bleeding is not platelet count, is the patient's age. So we decide treat or not treat based on 4 factors. One is platelet count, of course. The second is bleeding score, how severe the patient bleeding. And the third is health-related quality of life. And the fourth is fatigue score, because fatigue is most common clinical findings, clinical phenomenon of the patient, very common. Close to 50% of patients may have fatigue. And based on those 3 criteria or points, we can start our treatment. And the treatment divided into first line, second line, and other lines. And the first line treatment is including corticosteroids, IVIG, and also anti-D antiserum. Anti-D antiserum is not available in China. So today we only talk about IVIG and corticosteroids. In my point of view, corticosteroids is very effective. The action is very fast. However, it has 3 limitations. The first one is very expensive. And the second one is the action of IVIG is very short. And the third is it may not be available all the time. So in my opinion, IVIG can only be used in those patients who are refractory allergic to corticosteroids, and in patients who refuse to receive corticosteroids due to some other reasons, and also in patients in very emergent situations. For example, patients who will take their tooth, or patient who will get a cessation operation. And the second first-line treatment is corticosteroids, which is most commonly used first-line treatment. There are mainly 2 kinds of drug. One is prednisone, and the other is high-dose dexamethasone. And the effective rate and time to response is very similar between prednisone and high-dose dexamethasone. However, in the guidelines of ASH, guidelines of International Working Group, they didn't recommend which one is the first choice. In our Chinese guideline published in 2018 in the International Journal of Hematology, we give first choice of corticosteroids as high-dose dexamethasone because there are few RCT studies which compare the corticosteroids and prednisone. And the most recent one is from China. There is a multi-center randomized controlled study compared the high-dose dexamethasone and prednisone in about 200 of patients, which is the largest cohort today to compare the 2 drugs. And the result of this study indicate high-dose dexamethasone have a higher CR rate, shorter TTR, time to response, and the safety profile of high-dose dexamethasone is much better than prednisone. Therefore, our Chinese guideline recommended high-dose dexamethasone as the first choice of first-line treatment in ITP patient. Thank you.